better sleep, sharper focus, a healthier life. It all starts with how you breathe.
Welcome to the No One Told Me, the Airway Health Connection, the Untethered Way, where better breathing meets better living. I'm Dr. Meggie Graham.
I'm Dr. Liz Turner.
We're the co-founders of Untethered Airway Health Center,
on a mission to help you breathe freely and live fully through proactive airway health.
Whether you're a dentist expanding your airway expertise,
or a family looking to sleep and breathe easier,
you're in the right place.
Each week, we'll bring you bold insights, real-world stories, and expert tips.
All to help you take control of your airway health. Because when you breathe better, you live better. Let's get started.
Pregnancy, breathing, and baby's first latch. Why dentists should care. Hey there, welcome back. I'm Meggie Graham, and this is another episode of No One Told Me, the Airway Health Connection, the Untethered Way. I am so excited to talk about today's episode or talk about today's topic on today's episode because honestly, no one's talking about this concept enough. Not dentists, not OBs, not mom to mom, not pediatricians, and yet it's something that affects all of them, all of us. It's about pregnancy, breathing, and that connection to a brand new baby's first latch at the breast and why dentists should care. I know that might sound a little odd at first, dentists talking about pregnancy outcomes, but I want you to hang with me because once you connect these dots, you'll never unsee them. And because it's so influential and not enough people know about it. It's not that people are gatekeeping, it's that it's not connected. It's not part of our story to discuss. Speaking of stories, let's paint a picture of a very healthy first-time mom. She's in her second trimester when out of nowhere, she starts snoring. Like she's never snored in her whole life. And suddenly she's congested at night. She's waking up unrefreshed and she's feeling exhausted. And that's really easy for her to shrug off. That's just pregnancy. She has no experience with this. And of course she's tired. She's growing life. Her partner also notices her sleep is disturbed, says her sleep looks restless, even kind of violent. She goes in for her prenatal checkup and boom, blood pressure starts to creep up. The obstetrician or the midwife says, let's keep an eye on it. It's probably not a big deal, and continues to check her at her weekly visits. Her blood pressure continues to climb higher. Proteins show up in her urine, and now the word preeclampsia enters the chat. Everything changes. She's induced earlier than planned. Her labor is extremely long. It ends up in a cesarean section. The baby's born prematurely and has to go straight to the NICU. And in the NICU, the first latch of the breast, gone. There's no golden hour. Their feeding is delayed. Breathing support is a priority. Baby's placed on a CPAP, which is life-saving, of course, but it's pressing on this tiny nose and fragile midface. Feeding is slow to organize. The baby's working so hard just to coordinate feeding and breathing. Weeks later, they all go home, grateful, relieved, totally exhausted, and honestly, already on a harder airway and feeding path than anyone ever expected. And here's the kicker. Most people stop the story there. They go, well, thank God for modern medicine, which yes, of course, it's amazing, it's miraculous. The baby is alive, the mom is safe. But if you zoom out, so much of this traces back to breathing and what if we would have caught it? So why should we as dentists care? I am a dentist and I'm up here spreading this word because it's so important because as airway dentists, we're in this really unique spot. We help people decrease dental risk and decrease systemic health risk by helping them breathe better, help babies and little kids grow better, help adults overcome years of airway dysfunction. And sometimes that means going upstream, zooming way out and looking at even pregnancy. So now, full disclosure, they did not teach this in dental school. All I ever heard about in pregnancy dental visits is bleeding gums, gingivitis risk, see your hygienist more often. Is this important? Well, absolutely. But what nobody mentions is that how a mother breathes, how she sleeps, can influence her risk of preeclampsia, and preeclampsia, or hypertension in a pregnant woman, is one of the biggest drivers of preterm birth. And since the mom may have been given the instruction to see the dentist more frequently, we have an opportunity. So that misunderstanding or not understanding that breathing is such a big component is a big missing piece. Pregnancy reshapes breathing. Pregnancy changes everything, including the airway. Hormones like estrogen, they increase blood volume, which makes tissues swell. So those soft passages in the nasal passageways, the turbinates, and the mucosa in the throat, they swell and the space gets narrower. It gets harder to pass air through. Healthy weight gain can even add tissue around the neck. The uterus pushes the diaphragm up as the baby grows, and meanwhile, oxygen demand goes up by about 20% because of all the exertion the pregnant woman has to exude every single day just to function carrying around that baby. So even women who never snored before, suddenly they're snoring. They're mouth breathing, they're clenching their teeth, they're grinding their teeth. Check back on some previous episodes where we connect the dots between how clenching and grinding is a breathing issue. They feel wiped out even after 8 to 10 hours in bed, and studies back this up. I will have all of the research that I'm citing in our podcast notes, so by all means, peruse through it and use it to your advantage. I've done the heavy lifting for you by collecting it. So studies back this up. Sleep disordered breathing is 2 to 3 times more common in pregnancy than outside of pregnancy. That's huge. So that's most women are expected to have breathing issues of some sort while they're pregnant. So let's talk about the connection of sleep disordered breathing to hypertension, or in this case, preeclampsia. So here's the problem. Sleep disordered breathing isn't just about being tired. Every time the airway collapses, oxygen dips, the brain goes, wake up, breathe, adrenaline surges, mom goes into fight or flight, into a sympathetic state, blood vessels tighten, the heart rate spikes, and this happens over and over again. That stress response keeps the blood pressure elevated, and in pregnancy, that becomes gestational hypertension or preeclampsia. And remember, preeclampsia is one of the leading causes of preterm birth. Globally, it accounts for 20 to 30% of preterm deliveries. I want to talk about the cascade. Mom can't breathe well. That leads to preeclampsia, or could lead to preeclampsia. Preeclampsia is unsafe, and so that leads to early induction or maybe a cesarean section, and the baby is born prematurely. So now the baby's cascade. The baby has its own airway issue from that cascade of the mom not being able to breathe well. Baby misses the first latch at the breast, and listen, that latch isn't just bonding. It's not just about oxytocin or milk supply. The latch organizes the suck, swallow, breathe reflex. It reinforces nasal breathing. It literally helps shrink the turbinates, those little soft tissues that I mentioned before that are our air filtration system in the nose. And it's nature's way of clearing things out so babies can breathe clearly through their nose. From there, breastfeeding builds on that. It drives the mid-face development, or the maxilla, the cheekbones, the floor of the nose. And the longer exclusive breastfeeding is able to continue, the stronger the nasal breathing patterns are later on. But preemies, they're less likely to be able to breastfeed successfully, and many of them need a CPAP. Again, it's life-saving, but CPAP use can injure these delicate nasal tissues, and prolonged pressure can alter the way the mid-face grows. So prematurity doesn't just mean tiny little size, it means feeding struggles, airway struggles, growth struggles right out of the gate. So let's zoom out again. Where do dentists fit into this? We're not managing preeclampsia. We're not managing hypertension. We're not delivering babies, hopefully. That would be a pretty exciting day in the office. But here's what we can do. We can start the conversation. We can notice when a pregnant patient is mouth breathing, snoring, not sleeping. We can ask very important questions. And as we uncover these risk factors, we can suggest simple, non-invasive tools. My favorites are nasal dilators. There's internal nasal dilators like Mute. There's external nasal dilators like Intake. They help keep the nostrils and nasal passageways open. There's myofunctional therapy, basically physical therapy for the mouth and the tongue. It retrains the muscles, improves muscle tone, and clears up airway space. We can also even discuss better sleeping positions, side sleeping, supported neck posture. Sometimes we might need to make a mandibular advancement device to help hold the lower jaw forward while they're sleeping to improve airflow. And of course, we don't dismiss a CPAP. The CPAP is still the gold standard. It saves lives, and it's been shown to reduce preeclampsia. We don't prescribe them, but we can certainly bring this to the mom's attention and have her talk about it with her care team. We can also start to make connections with these interdisciplinary providers in our communities. It doesn't have to be about either or. It can be about collaboration. It can be medicine. It can be dentistry. It can be structural. It can be supportive. Just keep zooming out and asking the questions, what does this mean long term? Airway dentistry has always been about asking better questions and connecting dots. Are you clenching your teeth? Are you grinding? Do you snore? Do you mouth breathe? Do you have excessive daytime sleepiness? Do you have high caries rate? Do you show signs of acid erosion? We ask these questions because we know that these aren't small details, they're risk factors. We're not trying to create a problem that doesn't exist. We're trying to reduce risk. We're trying to get to the root cause and uncover a problem that we might not be aware of. And often when you follow that thread back, it could go all the way back to mom's pregnancy. Did mom breathe well? Did she make it to term? Did the baby get that first latch? Were they able to breastfeed? This is prevention at its purest. All of these dots connected is so important to what we can do. The big picture is that optimizing breathing in pregnancy minimizes sleep disordered breathing risk. It can help protect moms by reducing their risk for preeclampsia, which then lowers the risk of preterm birth. And reaching term, that gives babies their best shot at latching, breastfeeding, nasal breathing, which leads to optimal growth and a lifetime of optimal nasal breathing. There's no guarantees, there's no magic wand, but we're talking about tipping the needle, reducing risk, and that matters greatly. And that is why dentists should care. So, all right, that's it for today's episode of No One Told Me, the Airway Health Connection, the Untethered Way. As you can tell, I'm very excited about connecting these dots and spreading this word. If it made you think differently, if it connected dots for you, you hadn't thought about this before, please share it. Send it to a friend, an expectant mom, a provider. Spread the word and make a difference. And if you like what you heard, give us a rating or a review and like our podcast on Apple or Spotify, wherever you're listening to us today. It really does help more families and providers find us, and we're obviously very passionate about this. You can also follow along on Instagram at Untethered Airway, where we share more resources and bite-sized stories. Thanks for hanging out with me, and remember that every breath matters from the very beginning of life.
Better sleep, sharper focus, a healthier life. It all starts with how you breathe.
Welcome to the No One Told Me, the Airway Health Connection, the Untethered Way, where better breathing meets better living. I'm Dr. Meggie Graham.
I'm Dr. Liz Turner,
We're the co-founders of Untethered Airway Health Center.
on a mission to help you breathe freely and live fully through proactive airway health.
Whether you're a dentist expanding your airway expertise,
Or a family looking to sleep and breathe easier.
you're in the right place.
Each week, we'll bring you bold insights, real-world stories, and expert tips.
All to help you take control of your airway health. Because when you breathe better, you live better. Let's get started.